Hello and welcome to our weight loss program. I'm Guillermo Higa. I'm the medical director for medical as well as surgical weight loss at this facility. I had the pleasure of doing my residency at the University of Arizona and my fellowship in weight loss surgery at the Cleveland Clinic. The purpose of this seminar is to tell our patients what are the steps before proceeding to surgical weight loss. Obesity is a problem that affects most of the countries in the world, especially the United States. The number of Americans with obesity has steadily increased since 1960, and today up to a third of the US adult population is considered obese. The definition of obesity is based on the NIH criteria. Basically, what we count is the body mass index. The body mass index is a number that we obtain from dividing the height and the weight of the patient. A patient with a BMI of 40 or a patient with a BMI of 35 with medical problems is a candidate for weight loss surgery. There are multiple conditions associated to morbid obesity. One of the most common are type 2 diabetes, heart disease, stroke, cancer, and sleep apnea. All those medical conditions can be reversed with weight loss. When we talk about surgical options, we have different ones. The lap band, the sleeve gastrectomy, and the Roux-en-Y gastric bypass. When we talk about who's a candidate for surgery, we have some criteria. Patients need to be at least 18 years old. In terms of BMI, we do surgery on patients who have a BMI from 35 to 75. In terms of weight, ideally we do surgery on patients that are 450 pounds or less. And it's key for every patient to be non-smokers and also not be on drugs or alcohol. The gastric band is one of the most common surgeries that we used to do. It consists of placing a silicone ring around the stomach, and this ring is connected to a port that goes under the skin. The band can be adjusted by injecting fluid inside this port. The more fluid we put inside the port, the tighter the band gets, and the more restriction the patient gets. The way it works is by restriction. The patient is not able to eat as much as before the surgery. The band was approved by the FDA in 2001. Unfortunately, this procedure is being less and less popular. And the reason behind that is that we are seeing a lot of complications after this type of surgery, especially heartburn and also band slippage. The slippage is when the band moves up or down, causing obstruction. This surgery is for patients that have a lower BMI. It's a simple surgery that takes about 1 hour under general anesthesia. In terms of weight loss, the band can give up to 40 to 50% of excess body weight loss. The benefits of the band is a less invasive surgery, it's reversible, we don't have to alter the anatomy, and it's an outpatient surgery. The sleeve gastrectomy is by far the most common surgery that is done for weight loss in the United States and also around the world. The sleeve gastrectomy works by creating restriction. And the restriction is due to removing part of the stomach. During surgery, 85% of the stomach is removed. The surgery, as you can see, is not reversible. The surgery is done under general anesthesia and it takes about 1 to 2 hours. Patients stay at the hospital one night and they go home the day after surgery. In terms of weight loss, the sleeve gastrectomy can give you up to 60 to 80% of excess body weight loss. Benefits of the surgery: first of all, it gives you more restriction than the lap band, and also by removing the fundus of the stomach, which is the top part of the organ, the levels of the appetite controlling hormone ghrelin goes down during the day. By this, the appetite of the patient goes down. In terms of the risk of the sleeve gastrectomy, one of the most common is bleeding, followed by a leak or what we call a stomach stricture. But fortunately, those are very, very rare. The other surgery that we do is the Roux-en-Y gastric bypass. The gastric bypass is one of the oldest surgeries that we have been doing for weight loss surgery. It consists of creating a new stomach, which is called a gastric pouch, and then rearranging the patient's anatomy by connecting the new stomach to the patient's small bowel. How it works? First of all, the patient has more restriction due to the smaller pouch, and also the patient has malabsorption because we have to alter the anatomy by joining two parts of the small bowel. The surgery takes about 2 to 2.5 hours. It is also done by general anesthesia. And in terms of weight loss, the patients can have from 50 to 80% excess body weight loss. The maximal weight loss occurs by the second year, and in terms of weight loss, long term, this is the best option. What are the benefits of the gastric bypass? 50 to 80% of excess body weight loss, and also resolution of medical problems like diabetes, high blood pressure, sleep apnea, and osteoarthritis. In terms of risks, the risks are similar to the sleeve gastrectomy. We have a risk of bleeding, risk of gastric leak, and risk of bowel obstructions. If we compare the sleeve gastrectomy and the gastric bypass, which are the most common surgeries that we do for weight loss, we can see that the sleeve gastrectomy is less invasive. Both surgeries are non-reversible. In terms of long-term weight loss, the gastric bypass is a little better than the sleeve. And in terms of risk, the gastric bypass, since it's a bigger surgery, it's a higher risk surgery. Nonetheless, both are very safe options. Follow-ups after surgery are key. We like to see our patients 2 weeks after surgery, then 1 month, 3 months, 6 months, and then yearly after. Besides surgical options, we offer non-surgical procedures, and one of those is the gastric balloon. The gastric balloon is an endoscopically placed silicone balloon, and it's inflated with saline. We like to keep the balloon for 6 months, and during those 6 months, we train the patient how to eat healthier. Criteria for this procedure are the following. Patient needs to be an adult. This procedure is mainly for patients who have a lower body mass index and patients who do not have too many medical problems. The benefits of the balloon is that it's simpler, it's an outpatient procedure. One of the most common complaints of patients after this procedure is nausea. The nausea is mainly due to distension of the stomach. Other complications can be stomach perforation and chronic pain, which are very, very rare. Nutrition is a key pillar in our program. Patients are going to be supervised by our nutritionist before and after surgery. The nutritionist will identify what challenges the patient is having in terms of dieting. We're going to set realistic expectations for surgery. I like to tell my patients that surgery is a tool to get our weight down, but it's not the cure for anything. No matter what we do, no matter how well the surgery goes, if the patient doesn't change their eating habits, and make healthier choices, the surgery won't work well. Why nutrition is important? Nutrition increases your metabolism. It will help you control your blood sugar. It will help you heal after surgery. And it will decrease the risk of chronic health problems. Before the surgery, we like to put our patients on a liquid diet and protein shake diets for 2 weeks. Once we do the surgery, patients are going to be on protein shakes for another 2 weeks, and then the diet will be advanced. The goals for nutrition after surgery: make sure that our patients have adequate protein intake, that they drink a lot of fluid, and also in terms of vitamins, it's key for patients to have vitamins, especially if they have a gastric bypass. The steps before the surgery consist of the following. We see our patients for a period of 6 months. During the first visit, patients are going to be evaluated by our nurse practitioner and myself, as well as the nutritionist. Psychologists are also involved in patients' care. It's important to have good family support for better outcomes. Thank you very much for picking our program. We would like our patients to have a good experience with us, since we offer a personalized plan. We like our patients to be part of the family and to have long-term good results.